Maastricht Medical Center is one of our partners, like the ministry. And we are very glad that we have two people in the house who will do the keynote now. It's Marjolein Heemels and it is Jeroen Hendricks. Can both of you show yourself already to the audience? Marjolein is Director of Nursing, and Jeroen Hendricks is a professor. He started as a nurse, but nowadays he's a professor. He worked a long time in Australia at 2 hospitals. Now you work closely together. Yes. You came back in Maastricht, Jeroen. And Marjolein, I think, is very glad.
Yes, I am very glad. With such a great colleague.
Marjolein will start because it's also their anniversary today, not the birth anniversary, but of their department. 5 years of the nursing department. So Marjolein, tell us what you did, and Jeroen, afterwards, tell us what is the secret for nurses to be innovative. Marjolein first.
Thank you. Dear colleagues, it's a great honor to open the nursing track of ICT&health today. As a nursing director representing the nursing profession of Maastricht UMC and beyond. As a nurse, my passion has always been to strengthen our profession, ensuring that nurses have a voice in shaping the future of healthcare. Throughout my career, I have seen firsthand the incredible impact of nursing on patients, families, and the entire healthcare system. But I've also seen a lot of challenges, high workloads, increasing complexity, and the struggle to have our expertise fully recognized in decision-making processes. That is why I stand here today, because I believe that innovation in healthcare can only succeed when nurses are at the heart of it. For too long, technological and organizational advancements have been designed for nurses rather than with them. If we want real, meaningful change, we must ensure that nurses are not just end users, but active drivers of innovation. And that requires professional leadership, structural involvement, and a work environment that supports both autonomy and collaboration. In a time of rapid technological advancements and increasing healthcare challenges, this event underscores an essential truth. Innovation in healthcare cannot thrive without giving special attention to the nursing domain. As nurses, we are not only caregivers, but we are also key observers of how care is delivered and experienced by patients. This unique position enables us to identify challenges and opportunities for improvement. However, to truly harness this potential, we must ensure that nurses are actively engaged in shaping the future of healthcare. Nursing work is complex and highly specialized and valuable, making nurses increasingly seen not as workers at the bedside, but as essential key drivers for the quality of care. We all know it's time to act. Nursing shortage. Europe-wide countries face severe challenges related to healthcare workforce. What we need as nurses is a reappraisal of nurses as a profession and as professionals and their position in healthcare organizations and in the healthcare system. We think that this can be initiated by the development of a strong professional identity of nurses. However, there is still a lack of a clear model to shape professional development and organization. There's an increasing call from both politicians and the professional field to involve nurses more in decision-making relating to nursing practice. Professional control, autonomy, or professional governance is mentioned as a keyword. However, more is needed than quotes on control. Sometimes professional control seems to be an end goal itself. Instead of better care for patients, a better job experience for nurses, and thus one of the solutions to labor market issues like engagement, retention. And in addition to professional control or professional governance, other solutions are also proposed, such as career paths and training opportunities. However, these are not standalone and equivalent alternatives, but rather conditional to the sustainable development of professional control. The danger of cherry-picking in policy alternatives to the issue is present. In collaboration between several academic centers in the Netherlands, we have created a model for the development of a professional nursing organization. It's developed departing from the hospital organization, but it seems to be a general model fitting in all nurse work settings. In the model, you'll see that professional identity is placed as a fundament on all the next steps. With this model, organizations can develop an integrated policy to nursing professionalization and innovation to improve outcome for patients, nurses, and the organization. Here you'll see the most important pillars of our nursing strategy in Maastricht UMC. Over the past 5 years, we have worked tirelessly to enhance the professional identity of nurses while building new structures for leadership and collaboration. And this is just the beginning. The coming years will be dedicated to further developing future-proof healthcare at MUMC under the motto, think big, act small. Guided by our vision for a more nursing-focused MUMC, we take small but meaningful steps every day, despite challenges such as high workloads and staffing shortages, to bring that vision to life and implement nursing innovations sustainably. An inspiring example, and I'm very proud of it, is the implementation of nursing councils at 3 organizational levels. These councils are based on examples from magnet hospitals. We have implemented councils at the departmental, center, and hospital level, and their core purpose is to enable nurses to discuss and implement improvements and innovations, as well as to identify the necessary resources to do so. Through these councils, we empower professional autonomy and decision-making among nurses. Nursing leadership and a professional work environment foster a positive mindset toward change and innovation. These elements are essential in making teams more innovation-ready, allowing them to better embrace technological advancements. Over the past 5 years, we have worked tirelessly to enhance the professional identity of nurses while building new structures for leadership and collaboration. And this year is particularly special for us, as mentioned earlier. 2025 marks the 5th anniversary of the Department of Nursing, and we celebrate our first lustrum during this ICT&health Congress. And I must say, reflecting on the past 5 years fills me with pride. Pride on all my nursing colleagues, also present here today. Together with many dedicated colleagues, we have made significant strides forward. Together, we can shape a future where nurses are not just participants in innovation, but its drivers. And today's nursing track is a testament to the importance of this approach. It brings professionals together who share a commitment to embedding innovation within nursing practice. Let us use this platform to share knowledge, inspire one another, and collaborate across disciplines to push the boundaries of what is possible. I would like to thank the organization of the ICT&health Conference, led by Tom, Lucien, and Irene, for the opportunity you gave us to organize this nursing track. I would also like to thank the board of Maastricht UMC, in particular Helen Mertens and former board member Ale Houtsma, to make this possible also. And of course, last but not least, I really would like to thank the Nurses on the Move organization, of Maastricht UMC, under the leadership of Mick and Yvonne, who made a wonderful program today in collaboration with our Nursing Advisory Council and many nurses out of Maastricht and out of all over the country. Thank you very much for that. But no, I'm not ready yet. My last slide. Before we dive into today's program, I am thrilled to introduce my co-speaker. It is a privilege to welcome our new professor of nursing and my new colleague, Jeroen Hendricks. Jeroen, you bring a wealth of experience and a fresh perspective to our profession. And I am confident your expertise will inspire and energize us all. And we continue together our journey toward innovation and excellence in nursing. With his chair, Jeroen focuses on the development and evaluation of innovative models of care, delivery-based on the concept of integrated care. You're going to tell us more about that soon. Integrated care aims to improve the efficiency of care, improve patient engagement and patient outcomes, and provides crucial career opportunities for nurses. Also, it encourages interdisciplinary teamwork and shared leadership. And this aligns with what I just demonstrated in my explanation of the nursing strategy in Maastricht. Thank you all for being here, and I really look forward to the inspiring discussions ahead. Jeroen.
Thank you all. Thank you so much, Marjolein, for the great introduction. Good morning, everyone. It's great to see you with so many people, and I guess there's many nurses in the audience as well. I hope many nurses from the Netherlands, but also from abroad, and probably also from Maastricht, because we have the hospital just next door. It's a true pleasure for me to be here today to talk to you about integrated care as a model of care delivery to future-proof, sustainable healthcare. But before I start, and given that we have the nursing track today, I would like to pay tribute to the mother of nursing, and that is Florence Nightingale. And I would like to share a quote from her, and that is, "Nursing is a progressive art such that to stand still is to go backward." So I think she has inspired many nurses around the globe already with this quote, but now in this difficult time, in the time of innovation, we need to look back at this as well. Because we heard it just before, we're dealing with an aging population, and as you can see in the figure, aging goes hand in hand with an increasing number of patients with multimorbidity. And that makes that the care is more complex. But also in the nursing profession, there's issues. We have global workforce issues. We have shortages of nurses. And that goes hand in hand with the fact that the nursing profession is maybe not that attractive anymore, and that there's lack of career opportunities. So I think we need to redesign healthcare. We need to do something about that and look into the future of care delivery. But how does that look like? Well, I think we need to really focus on personalized, tailored care to the needs of the patient. So it's no longer one size fits all, but we need to try to make the size fit for every individual. And then care should be co-designed with patients and carers, and it's really important the language we use with that. It's not about what is the matter with you, but what matters to you. What do you need? How can we help you? And how can we guide you to achieve your goals? And then one crucial question is also, is one healthcare professional able to appropriately address the complex care in those patients, or do we need to think out of the box, work collaboratively in interdisciplinary teams? ICT and health, the name says it already, we can't be without ICT anymore to really support optimization of care. And that brings me to innovative models of care delivery, such as integrated care, that is really provides personalized care based on the patient needs and is aligned with recommendations from the guidelines. But what is integrated care? Let's look into that. So the definition from the Association of Cardiovascular Nurses and Allied Profession, an international association, is focusing on it as a coordinated organization of a continuum of care delivery across settings, responsive to the needs of each person to achieve better outcomes and health equity. And in a model, it looks like this. And what we can take away from this is that integrated care is a whole of system approach where we put the patient in the center and provide holistic care. That goes hand in hand with comprehensive care and treatment. And what I mean with that is that we don't look at the primary condition that patients need care for alone, but look further, look into underlying conditions, risk factors, and lifestyle modification. We need to work interdisciplinary and then embrace novel technologies to support the continuity of care, but also the integrated care approach. Now, I've been doing a lot of work in the field of atrial fibrillation, or AF, and I would like to use this as an example to show you how integrated care could work, but we could use this example to translate that to other conditions. Now, atrial fibrillation, as you might know, is the most prevalent cardiac arrhythmia, and the expectation is that the number of patients with AF will rise tremendously in the near future. But what is very interesting as well is that aging and multimorbidity are significant risk factors for the development or worsening of atrial fibrillation, and that is now what we're dealing with in society. So looking at this in this field, I think innovation and redesigning practices really needed to make sustainable care future-proof. This image comes from the international guidelines for treatment of atrial fibrillation, and this is how they actually show what integrated care is. And to me, there's 4 significant pillars, and when they are fused, that creates an integrated care approach. And first of all, that is a patient-centered approach. And with that, I mean that we need to actively engage with our patients, get them involved in their care process, to really see what their wishes are and how we can help them guide in a way to achieve their goals. But we need to prepare patients for that. We need to educate them and guide them into their focus on lifestyle modification and risk factors, for example. Then comprehensive care and treatment. I just mentioned that. It goes beyond the primary condition. We need technology support to guide our patients, provide them with education, but also guide them in their self-care and self-management. But we also have decision support technology, for example, to guide our treatment team through the care process with the patient and their carers. And then it's no longer one healthcare professional providing this complex care, but a collaborative approach where doctors, nurses, and allied professionals, together with patients and their carers, work closely together. Now, this is how that could look like. This is how a specialized hospital service for integrated care delivery could look like. You can see patient-centered, the patient in the middle, with around the patient a core team of those specialists working closely together and with the patient to really achieve their goals. And in the blue circle around that, technology to drive this. So this is how we actually developed the atrial fibrillation clinic here in Maastricht years ago. And this is a nurse-driven, interdisciplinary approach where I always use the 3E rule: engagement, education, empowerment. And this is mainly focused at patients to get them educated, to make sure they can take care of themselves, self-care, and keep them safe out of the hospital. But there's also other components that are really important. Adequate consulting time. Education takes time. You can't do that in 10 minutes, 15 minutes, but takes much longer. We need to set realistic and achievable goals, and then a structured follow-up to really check with the patient if we need to reassess. And of course, technology again. Now, you would say, like, but does this work? Is there a proof of effectiveness? And I would like to share 2 studies coming out of the Maastricht University Medical Center looking into integrated care. So this one is from a number of years ago. It was published in 2012, where we actually did a redesign of outpatient service and implemented a nurse-led AF clinic. And you can see in the images there a relatively straightforward intervention where there was a nurse and a cardiologist closely collaborating. We were following the guideline recommendations, and we used what we said then, dedicated software. But we would call that now AI, because this software would guide you through the care process. Now, alongside the implementation of the clinic, we also ran a randomized control trial. We recruited 712 patients with atrial fibrillation and allocated them randomly to the integrated nurse-led approach versus usual care by a single cardiologist. And what we were interested in was the outcome of a composite of hospitalization or mortality due to a cardiovascular course. And if you look into the Kaplan-Meier curves, you can see that the nurse-led approach is performing better. So in the nurse-led approach, there were less hospitalization and less mortality. So this led to a 35% relative risk reduction. We were very happy with that result, as you can imagine. But then other researchers also thought we need to take this broader and investigate this in multi-center setting, which was done a few years later. So 8 hospitals in the Netherlands were involved, a bit more patients and a longer follow-up, 3 years, but the endpoint was still the composite of unplanned cardiovascular hospitalization and mortality. But if you look at the figure now, you can see that the lines are much closer to each other. Still nurse-led care performing better, but if we do statistics, we see it's not significantly different. So freely translated, saying it doesn't really matter in which group you come, and that is very much surprising. Now, the researchers then did an extra analysis that they pre-specified, looking into this outcome in experienced centers versus less experienced centers. Now, an experienced center was defined as clinics that already had an AF clinic prior to starting the trial. So in these centers, nurses and cardiologists were used to working together. They were used to working with the software and were really ready to take this on. Compared to non-experienced centers, they started the intervention and the trial at the same time. And that is reflected in the results. Because if you look at the experienced centers, we see significant reduction in the nurse-led care, really working well. But if you look in non-experienced centers, we see almost the opposite, which is very disappointing. But from my side of this, I think my take on this is that we focus very much on patient education, patient involvement, but at the same time, we also need to prepare our healthcare professionals. We need to educate them and learn, like, how do we work together? So interprofessional learning is really crucial in this. And then also applying implementation science to prepare the redesign of the practice prior to implementing the intervention, and also assess the innovation readiness of people and centers. Now, ICT and health, I haven't been talking much about technology yet, but I would like to highlight this intervention, which was born out of emergency during COVID-19. This was actually established by an interdisciplinary team consisting of a cardiologist and a nurse. What was the situation? Outpatient services were closed. Consultations from face-to-face were converted to teleconsultations. So nurses and cardiologists were calling patients with atrial fibrillation, asking questions. What is your heart rate? Do you have an arrhythmia at the moment? And patients could not answer that. We did not have an ECG. We did not know anything. So what we did then is we asked patients to download an app on their smartphone. And through technology, the app makes use of the built-in camera and the light. And we asked patients to measure their heart rate and rhythm by putting their finger in front of the camera through 60 minutes measuring heart rate and rhythm. And then it goes to a secured cloud where there's AI processes looking into, is this the normal sinus rhythm, or is this an arrhythmia? Is this atrial fibrillation? And then we created an integrated care approach. We call that telecheck AF. So tele refers to teleconsultations rather than face-to-face consultations. Check is where we were really relying on the technology and on the involvement of our patients, being actively involved in this. And AF refers to comprehensive AF care and treatment delivered by this interdisciplinary people, nurses and cardiologists, and we brought that together. This was picked up through social media very quickly because all centers in Europe had the same issue, so it was spread over Europe. But what is very interesting now, like we're now a few years after COVID-19, and this approach is now embedded in clinical practice, and it is also approved for reimbursement by healthcare insurance. So it's really daily practice that this is used. And it shows that this innovation really contributes to sustainable, accessible, and affordable care delivery. Now, nurses, what is in this for you? Excuse me. I think integrated care is promising for opportunities for nursing roles. And it's not only by providing clinical state-of-the-art care and treatment, but it's also that specific coordination of care, of complex care within an interdisciplinary approach to really prevent fragmentation. But beyond that, there's opportunities for nurse leadership versus shared leadership. There's nursing research versus interdisciplinary research. And I can go on like this for a while, but I think what we need to think about is that there's career development opportunities and academic nursing where we combine clinical practice, education, and research. Have a think about that. And also what we could do is make nursing attractive again by changing the dynamics. So watch this space. Now, to conclude, I think that integrated care has potential to contribute to future-proof sustainable healthcare. I think we need such approach to really be prepared for the number of patients that we're going to see in the next few years, where we focus on improving patients' engagement and their outcomes. So let them do as much as possible themselves and keep them out of the hospital. And with that, we can reduce the burden on the healthcare system. But again, also for nurses, as healthcare professionals, there's something in it for you. You can work differently, but smarter and easier by using the technology to really reduce the workload. And then also those career opportunities where you, for example, can combine your clinical work with leadership, research, or other interesting opportunities. And with that, I would like to go back to Florence again, and I would leave you with her final quote, and that is, "I attribute my success to this. I never gave or took any excuse." Thank you very much for your attention.
Jeroen, thank you so much. I was wondering, what made you step down your nurse practice and went to study again?
That's a very good question, and it was actually empowered. I was empowered by our head nurse. So I started working at the Maastricht University Medical Center, and after a year, the head nurse asked me to come into her office. And mostly that is like that you're in trouble.
Yeah, you're fired.
Exactly, that's what I thought. But at this time, she said, like, what is your plan? Where do you see your future? Would you like to study? And that's where I actually started the combination between working on the ward and doing health sciences at the university here at Maastricht. And from one thing, there was another. Mm-hmm. You know, when the AF clinic came up, it was actually that the outpatient clinic of cardiology was undergoing a redesign to become a heart and vascular center, where there were interdisciplinary teams looking into treating patients from different perspectives. And they said, do we need nurses on board? And if so, where do they need to work and what are they going to do?
Do we need nurses on board?
Well, that's a different question, but anyway. And that's how I more or less moved away from the bedside to focus on a different aspect of nursing.
Marjolein, you told us you already work differently than in the past. And do you also see that you already are more attractive for career paths, etc., and attract more nurses nowadays? Yeah. In those 5 years?
It's difficult to say because the first 2 years of the 5 were COVID. So we did nothing else than COVID care. And so now for 3 years we are building this professional nursing organization, and we see a lot of signs that there are positive effects.
Can you mention one?
The retaining of nurses. I think it's slightly better than in the last years, but we really need, this is a long-term development, so we need more years to evaluate that.
Yeah, and most nurses say to me, sometimes it's difficult to get to the table for the decision making. Yeah. How's that in your hospital? Yeah. Can you step to the board and say, Helen, I want to change something?
Yes, of
course.
Do you agree? I can do that. I always can do that, but all nurses can do that. But it's so important to build structures in an organization, and we build structure, like I told about the council structure.
About the tables, yes, yeah, and the councils.
I see a lot of council nurses sitting here today, and they work in a council on their own ward. And at a hospital level, we all take that, what they say to me that is important, I take that to a strategic level. So that is how we develop our nurse governance.
Okay, yeah. Let's ask for light and questions from the room. Kijk. All male. Male questions. Oh, sorry, I have to take my mic.
Hi,
Mr. Jekel.
Yes, my name is Pieter Jekel and I'm from the AI Coalition for the Netherlands. So my question is about AI. Thank you for your great presentation, Marjolein and Jeroen, and a very important presentation. And my question is, if and how AI can help nurses and their way of working.
Well, I think you can use AI to reduce like the burden of the work, so to speak. But also, if I refer back to the AF clinic, how we use it is really for decision support. For example, like the care is so complex, and if you're with a patient in a consultation, for example, the system can think with you, not for you, but with you. But it can say in the end, like, why didn't you do so and so, or why did you do that? This is a patient with hypertension, but you don't give any medication, so what is wrong here, for example? So I think to support nurses and other healthcare professionals, of course, I think that is where we should be looking into using AI. But also for patients. You know, we give patients a task as well to focus on their self-care and self-management. So once they leave the hospital, they might forget, like, what were the instructions now? What am I supposed to do? So to guide them in their self-care, I think we need that technology as well.
But Jeroen, is it also important that in the development of AI and all the things you can do with AI, in the first stage you also put nurses and patients at the development table?
Absolutely. There's a slogan, and this is, so back to the European Society of Cardiology, they have like a council there of patients, and their slogan is "Nothing about us without us." And I think that says it all.
I think that's a great one.
Yeah, absolutely.
Bart, Ministry of Health.
Yes, thank you very much. A very inspiring talk. I started my career as a nurse when I was 18, and then later in life became a general practitioner. So everything you were talking about, integrated care, is music to my ears, of course. And as you know, the number of support staff in general practice has greatly increased over the last years. Some of them are nurses, but not all. So I was wondering, how can we in family medicine learn from your experience in the hospital, and are you already cooperating with primary care specialists?
I think that's fantastic to do it there, because my view was from the hospital, but we can also, you know, apply that to the family care, for example, and have an integrated approach there. I think one of the visions from the Maastricht University Medical Center is from home to home, so from the hospital to home. And I think that's where we can find each other and where we should collaborate. We heard that also from Abigail this morning. And over the past few days of this conference, we need to collaborate more to really focus on our patients. So I would love to talk to you more about that, but I think that's the right approach.
And in addition to that, I think it's also very important for the general practitioners to really give the nurse practitioners a crucial role. And there are coming more nurse practitioners in the general practitioner world, but I think that you can make a big step forward there as well. Yeah.
Other questions? I see one over there, and I see one over here. Please, who are
Hey,
you?
my name is Betty Klaasens. I'm very curious, Jeroen, in your talk you stated that the profession is also getting less attractive, and that's one of the main goals to tackle. But what do you think, and I'm also curious about Marjolein, her answer, what is the main problem why it's not attractive anymore?
I think the main problem is the workload and a lack of autonomy. So in our nursing strategy, you see that we have answers to that by building structures, by creating autonomy, by developing the professional identity. So it's on a lot of different levels, a lot of different pillars that we have to develop to have an answer to the reasons why nurses leave the profession.
Yeah, and I think my vision to that is that you hear a lot that people say, I don't want to work full-time anymore in clinical nursing. Mm-hmm. And what you then see is that people leave the profession, and that goes hand in hand with a reduction of quality of care. Yeah. Because, you know, like you need those experienced nurses on the bedside, at the bedside as well. So I think if we can think about like strategies where we can offer those nurses something else as well. So you work on the ward like part-time, but also part-time in leadership roles or research or whatever it is, to really combine that. I think that is something we could try out.
Mm-hmm. Okay, thank you so much.
Thank you.
Question over here in the back of... Can you stand, please? That's for me. I will hold on the mic.
Marcia van Oosterwaard, Vicarie. Can you tell me something about how nursing research has a role in this what you were just explaining to us? And how do you arrange it in your hospital, for instance?
Yeah, we started a few years ago with creating a culture wherein evidence-based practice was normal in the nursing practice, and we're still developing that. So that is a lot of training for nurses, a lot of training for our nurse councils or coordinating nurses in evidence-based practice and what it is. And of course, we are very happy that Jeroen is now present with us, so we can really develop nursing research and nursing research lines wherein we can develop very important nursing research ourselves.
Yep. And just to add to that, I think, you know, we're not saying like every nurse needs to do a PhD track now, but, you know, it can also be, again, think big, but act small.
Yeah.
It can be these little small steps, you know, focusing on really evidence-based care, like what is that about? Where are the gaps, and how can nurses also contribute to new evidence and improvement of the guidelines? You know, these kind of things is really maybe thinking out of the box, but that is what we would like to further explore in the next few years.
Yeah, and speak up, I think. If you have good ideas, speak up to the management, to your colleagues, and that will also help.
Exactly.
Is somebody waving still? No? Okay. Thank you so much. It was wonderful.
Thank you.